Hello student, myself KKP Singh, Department of Physiology, Anugrah Narayan Bhagat Medical College, Gaya. My topic is from GIT, gastrointestinal tract, disorders of gastrointestinal tract. Gastrointestinal tract, actually a few general complications is there about the GIT. First, in esophagus, there is two abnormality. One is reflex esophagitis and second is eclasia. To know the eclasia and reflex esophagitis, one should know first the lower esophageal sphincter. Second disorders is there in the stomach and very common is peptic ulcer. Peptic ulcer arises in the stomach and upper GIT. Third common complications is aerophagia. Aerophagia and diarrhea, constipation and ulcerative colitis. So first I should start with eclasia. Eclasia is a common condition in which person does not inhale the food or the liquid in the stomach. Actually there is contraction of the lower esophageal sphincter. So it is necessary for you people to know the sphincter there at the gastroesophageal junction, that is lower esophageal sphincter. There is actually three important structure is there in lower esophageal sphincter. One is the circular muscle which creates the inner sphincter, and this is esophagus, the stomach. There is longitudinal muscle fiber, and at the lower end of at the junction there is prominence of the circular muscle in the esophagus. This muscle is circular muscle fiber which creates the internal sphincter, known as intrinsic sphincter. There is a diaphragm. Diaphragm surrounds all the lower esophageal center. All along the lower esophageal center, each surrounded by diaphragm. This diaphragm which attached with the esophagus is known as crural portion. Crural portion. And next layer is costal portion. Costal portion of diaphragm. This crural portion creates extrinsic sphincter. Extrinsic sphincter. And third structure is the sling fiber of the stomach. The sling fiber or oblique fiber of the stomach, oblique or sling fibers of the stomach, which creates a flap on the lower esophageal sphincter. Anything, if the intra gastric pressure is increased, This creates a gate-like structure. This fluid oblique skin fibers create a gate, and the stomach content does not normally pass into the esophagus. In the eclasia, the food deposited in the lower esophageal sphincter and doesn't pass in the stomach. There is serious condition, and the best possible treatment is a nasogastric tube is passed in this esophagus with a ballooning is there, and balloon inflates and the food passes into the stomach. This is the common treatment nowadays. And second treatment is myotomy near the lower esophageal sphincter. Is the surgery or myotomy of the lower esophageal sphincter. How does this appear? Eclasia appears because during peristaltic wave, the forward direction of the peristaltic wave, the intrinsic nervous fiber, the vagal fiber or this parasympathetic nerve does not secrete, stimulates this muscle, but there is no secretion of nitric oxide and vasoactive intestinal peptide. These two hormones is responsible for dilatation of this lower junction, and this does not appear in the eclasia, and food does not pass in the stomach. And the treatment is nasogastric tube. Gastric tube with ballooning. And second condition is reflex esophagitis. Reflex esophagitis. In this condition, this doesn't work, and the stomach contents during high gastric pressure pass into the esophagus. The patient complains of heartburn, dysphagia and irritation. The three common conditions is there. One is heartburn, and this acid from the stomach can create an ulcer on this wall of the esophagus. In that condition, only treatment is cimetidine, or the acid secreting zone is prohibited by omeprazole. Now there is so many drugs which is responsible for for the cure of this reflex esophagitis. They are cimetidine, ranitidine, famotidine, omeprazole, pantoprazole, and so many. Yes, this drug is known as H2 receptor antagonist, and there are so many H2 receptor antagonist drugs. H2 receptor antagonist drug, this is given regularly, and patient has no complaint of this reflex esophagitis. The second disorder is peptic ulcer. Peptic ulcer is very common disorders, and the peptic ulcer is due to secretion of acid, which and the stomach, which is this is stomach, and this is duodenum, and this is stomach. the mucosal parts of the stomach is, there is a thick lining of mucus, and this mucus has a gastric pit and many of the acid secretion cell. This gastric pit is protected by bicarbonate HCl3 secreted by the mucosa. In case of peptic ulcer, the acid secreted from this parietal cell obliterate or create an erosion on the mucosal wall. Side by side, this creates autodigestion of the cell. Normally this layer is responsible for the autodigestion of the gastric mucosa, but in case of peptic ulcer, the acid is so strong that this obliterates the mucosal cell and bicarbonate layer and create a ulcer. The cause of this ulcer is enteritis, H. pylori, this enteritis is protected from H2 receptor antagonist medicine, and H. pylori is treated by antibiotic. And third cause is gastrinomas. This is the tumor of the gastric cell which create large amount of gastrin hormone, and gastrin hormone act on this cell, and this protection is obliterated. Other common gastric condition of the large intestine is constipation, diarrhea, ulcerative colitis. In case of constipation, the patient, there is a strong and thick fecal material, and the secretion in the constipation is due to slow movement of feces through the large intestine. A large quantity of dry and hard feces accumulates in the descending colon, and it is caused by insufficiency of water and fluid intake and excess of fluid absorbed in the large intestine. The other factors are the pathology of the intestine, that is obstruction of the movement of intestinal canal such as tumor, contraction of the intestinal ulcer, and the contraction by the intestinal ulcer also. The inflammation is infants are seldom has a constipation because in the earliest stage the mother gives a proper training for defecation of the infant. So infant has no complaint of constipation. If it does not allow the if a person does not allow the defecation because of the social or some other reasons also, this reflex is die out. The reflex die out. In other case, there is excessive use of laxative also. This excessive use of laxative, the bowel movement and the colon become atonic and the constipation occurs. Sometimes gastrocolic and duodenocolic reflex causes mass movement of the long and large intestine in early life, which this reflex is dull and large and causes constipation. And one is megacolon. Megacolon is the extension of the colonic part of the large intestine, and the exact cause of this is not known. But megacolon is the accumulation, fecal matter accumulates in the colon that result in the extension of the colonic diameter for 3 to 4 inch. The condition is called megacolon. This condition is due to deficiency of ganglion cell and in mesenteric plexus in the segment and of the sigmoid colon, and there is no strong peristaltic movement, and the result is constipation. The next topic is diarrhea. Diarrhea is the rapid movement of the fecal matter through the large intestine, and this is several causes of the common causes is for diarrhea also. The enteritis psychogenic diarrhea is caused by enteritis, psychogenic diarrhea, and the ulcerative colitis also. In enteritis, the inflammation of the intestinal tract usually causes by the virus and bacteria in the intestinal colon. Intestinal infection persists in the large intestine and the distal end of the ileum. When occur, the infection is there in the mucosa and become irritated, and the rate of secretion is greatly increases that in that place, and that intestinal movement is increased at the same time. The increased movement of intestinal lateral intestine in the descending colon causes diarrhea. In case of cholera, the cholera toxin is there in the lower sigmoid colon and also in the ascending parts of the colon. The internal structure of the intestine also, the crypts of lubricant, which secretes large amount of water because of the cholera toxin, and secretes about 6 to 8 liters of water daily, while all the waters are absorbed and 2 to 3 liters of water passes daily through the stool. And if not treated properly, this cholera toxin may be life-threatening also. The second is psychogenic diarrhea. Sometimes it has been seen by the in the army or in the examining students also. When examination is there, they sometimes complaints of diarrhea. At the same time, in the army also, some of the army, while going to front for the battle, they sometimes complain of diarrhea. This is known as psychogenic diarrhea. And third is ulcerative colitis. Ulcerative colitis is a very difficult condition, and there is a complete inflammation and ulceration of the whole of the colonic area. There is large amount of secretion of water from this inflamed tissue, and patient complains of diarrhea, regular diarrhea. There is no clear treatment for that. Sometimes surgical treatment is there. It is seldom treated or cured automatically, but the in true treatment is surgical treatment, and there is complete resection of the colon is done. This is all about the disorders of the GIT, and in the next class I will talk to you about the gut-brain axis. This is next time I will talk to you about this gut-brain axis also. Thank you.